My name is Kara Alderson. I'm in Nursing 5120, Section 439 with Mier. Here is my student ID. I'm going to be assessing CA, a 75-year-old male today. Before we get started, do I have your consent to assess and record you?
Yes.
Okay, so you can see I have my blank piece of paper, blank clipboard. He does have a list of medications. This is just for him, and I will not be touching it. We'll start with our 360-degree scan of the room. We have over here, empty couch. We have my supplies that I will be using. We're in an RV. You can see there's no electronics, no study materials, no one else in the room with us. And we are now going to get started. I'll exit and I'll enter the room again.
Come in.
Hello, my name is Kara. I'm going to be interviewing you and assessing you today. Before we get started, can I get your name?
CA,
Date of birth?
July 20, 1946.
Your gender?
Male,
And your ethnicity?
white.
Okay, so what brings you in today?
My annual physical checkup.
Okay, when was your last physical checkup?
About a year ago.
Okay, and did they do any tests at this time?
I did blood work.
Okay, what blood work did they do?
Primarily a prostate and my blood sugar.
Okay, what medical conditions have you been diagnosed with before?
Well, I have sugar diabetes, high blood pressure, and acid reflux.
Okay, and do you know what medications you're taking?
I take 2 metformin 500 milligram in the morning and 2 in the afternoon. I take 1 glypiride at night, 2 milligrams for my sugar diabetes. Take omeprazole in the morning, 20 milligram for my acid reflux. Take a simvastatin, 20 milligram, 1 pill nightly for my high cholesterol. I take a lisinopril, 20 milligrams, 1 in the morning for high blood pressure. And right now they have me on magnesium, 350 milligrams, 1 in the morning and 1 at night.
All right, and are you allergic to any medications?
Not that I'm aware of.
And have you ever been hospitalized?
Yes, I had bleeding ulcers, and that's when they found my acid reflux, and they ran a tube down my throat and found 2 ulcers at the top of my stomach, and they started my treatment of omeprazole, and it's controlled it ever since.
Okay, and have you ever had any surgeries?
I've had skin surgery. I've had a melanoma on my ear removed, plus several basocarcinomas. That's not totally correct, but I've had 2 or 3 of those surgeries.
Okay, and then I just want to get a quick family history to know what to look out for. If you'll just let me know if your parents, are they living?
No.
Okay, do you know if your mom had any medical conditions?
She had a stroke, and she also later developed bone cancer.
Okay, and what about your father?
He had sugar diabetes and died of a heart attack.
Okay, what about your mother's mother?
She had a stroke.
Okay.
That's all I can remember.
And your mother's father?
He had asthma and emphysema.
Okay, and your other grandparent, your father's
Father.
Yes.
He lived to be 84 and died of a heart attack, but he also had a stroke.
Okay, and your father's mother?
She lived to be old age into her 90s.
Okay, and have you had any kind of complaints recently? Any trouble breathing, abdominal pain, any kind of pain?
No.
All right, anything bothering you right now?
No, I'm good health except for my sugar diabetes.
Okay, did they check your diabetes last time you were at the office?
Yes.
And what was your A1C?
I believe it was a 7.3.
Okay. All right, so now I'm going to start my assessment of you. Can you tell me your name?
CA.
What year is it?
2022.
Where are you?
I am at the clinic for my annual checkup.
And why are you here?
Well, I need a yearly checkup.
Okay. So now I'm going to start by looking at your skin. I can see his skin. He does have a tan line here. Do you spend a lot of time in the sun?
Yes.
And do you go to the dermatologist regularly?
Twice a year.
Okay, we can see just some dry skin there. His skin is even. He does have an abrasion on this arm here. What happened there?
I was working on a plow and hit a plow disc.
All right. We can see his feet are a little more red. His skin appears to be warm and dry. There's no flakiness. Skin turgor has a quick return to baseline. We can see on his foot his nail bed is firmly attached. Nail base angle is 160 degrees. Cap refill is less than 2 seconds. His nail bed is pink. His nails are equal. They're symmetrical, and there's no ridging or clubbing. Can you do this for me with your thumbs? To put the nails together for me?
No.
There you go. Nail base angle is 160 degrees. His nail beds are pink and firmly attached. His nails are symmetrical. He has cap refill less than 2 seconds bilaterally. And then you can see that skin turgor is quick return to baseline. His hair does not appear to have any male pattern baldness. If I look at his scalp, there's no areas of inflammation or scarring. Palpating his hair, it is dry and fine in texture, but not brittle. If I look at his head is symmetrical. His eyebrows line up, his eyes line up, ears line up with his eyebrows. We do have the missing top of this left ear over here from that melanoma excision he was talking about. Now going to look at eyes. I'm going to palpate your eyelids real quick. Any tenderness?
No.
Eyes are firm. Any tenderness here?
No.
No tenderness in the lacrimal apparatus. If you'll open your eyes, sclera is white bilaterally. The iris is blue. The lens is clear. Conjunctiva is pink and moist. We have our Snellen eye chart here. This is one that would normally be used to assess near vision. You're going to hold that about 14 inches from your face. And can you read the smallest line you can see?
63925.
All right, so that is 20/50 vision. So we do have some presbyopia. Do you normally wear bifocals?
Yes.
Okay. Going to assess. I see his pupils are equal and round. We have direct and indirect or consensual accommodation. Can you look at that wall right there and cover your right eye and uncover? There is no deviation, and do the same for your left and uncover. No deviation is noted. Now I'm going to have you follow my pen light with using just your eyes. Patient able to do so in all 6 cardinal directions with no lag or nystagmus. I am now going to do the pen light. If you'll look straight ahead. The light shines symmetrically, even on both sides, on the inner portion of both eyes. Now going to use my ophthalmoscope to look at his eyes. You'll hold your right thumb out in front of your right eye. All right, and you can drop it, going 15 degrees from baseline. Seeing the red reflex and moving in. Optic disc is well defined. There is no edema, erythema, exudate, or presence of AV nicks or hemorrhages. Going to do the same on the left eye. See the red reflex? I'm going to move in. Again, optic disc is well defined. There is no edema, erythema, exudate, or presence of AV nicking or hemorrhaging. I'm now going to move on to his ears. Any tenderness?
No.
External ear is symmetrical. No tenderness with palpation along the mastoid process. Ear canal is pink. There is no exudate or cerumen. The tympanic membrane is intact and pearly gray. Going to do the same on the left ear. Again, tympanic membrane is intact. It is pearly gray. There is no exudate. There is hair. There is no cerumen. We are now going to move on to your nose. His nose appears to be symmetrical. There is no evidence of a deviated septum. Get this on. On the right, his mucosa is pink. The turbinate is intact. There is no drainage. There is nasal hair present. No polyps are noted. Going to do the same on this side. Once again, the mucosa is pink. There is no drainage. There is an intact turbinate and no structural damage is noted. No polyps. Nasal hair is present. I'm now going to move to his sinuses. Please let me know if this is tender. Palpating the frontal sinus. Any tenderness?
No.
Maxillary sinus.
No.
Lips appear to be pink and dry. If you can open your mouth for me, please. All right, mucosa is pink and moist. Tonsils are a normal size. There is no edema or erythema. There is no cobblestoning present to make me think he has a postnasal drip. Can you smile? His teeth appear to be intact. There is a few crowns on his bottom teeth. We are now going to move on to your neck. So I can feel his trachea is midline. Now going to assess for his thyroid. There is no thyromegaly present. Can you swallow? Thyroid moves with swallowing. I'm now going to auscultate for a bruit. No bruit is detected and there is no trill on palpation. Now going to assess his carotid artery, making sure not to do this at the same time. Carotid artery is +2 on the right. Carotid artery is +2 on the left. Going to listen for any sounds. No bruit is noted on the left. No bruit is noted on the right. We're now going to move on to chest. His chest appears to be symmetrical and appears that he has a normal respiration rate of 16. Breasts are unlabored. There's no abdominal muscle use. And take a deep breath for me. Chest appears to expand symmetrically upon inhalation. I'm now going to listen to your breath sounds in all fields using the diaphragm of my stethoscope. If you'll take a deep breath every time I place this. And raise your arms, please. Deep breath. Breath sounds are present in all areas. There are clear and equal bilaterally. There are no diminished breath sounds or adventitious breath sounds such as crackles or wheezing. I'm now going to listen to on the back if you'll turn around for me, please. And just take a deep breath once again. And if you'll raise your arms once again for me, please. Again, breath sounds are noted in all areas. There are no diminished breath sounds or adventitious breath sounds such as crackles or wheezing. I'm now going to move on to his heart. I do not see any palpitations or thrusts upon inspection. I am now going to feel for precordium. No precordium is noted. I'm now going to palpate for an apical pulse. And I can feel his apical pulse. I'm now going to use the bell of my stethoscope to listen to his heart sounds, and then I will repeat it with the diaphragm of my stethoscope. Normally you would do this sitting, laying supine, and laying left lateral recumbent, but for the purpose of this examination, we'll just do it sitting. Starting with the bell of my stethoscope, I'm going to go to the second intercostal space on the right sternal border to listen to the aortic valve. I'm now going to go to the second intercostal space on the left sternal border and listen to the pulmonic valve. Going to go to the third intercostal space on the left sternal border to listen to Erb's point. And then I'm going to go to the fourth intercostal space on the left sternal border to listen to the tricuspid valve. And the fifth intercostal space on the midclavicular line to listen to the bicuspid valve. In all areas, using the bell of my stethoscope, I heard S1 and S2 heart sounds. There were no extra heart sounds such as S3 and S4, and there were no adventitious heart sounds such as clicks or murmurs. I'm now going to repeat the process using the diaphragm of my stethoscope. Going to go to the second intercostal space on the right sternal border to listen to the aortic valve. Second intercostal space on the left sternal border to listen to the pulmonic valve. Third intercostal space on the left sternal border to listen to Erb's point. Fourth intercostal space on the left sternal border to listen to the tricuspid valve. Fifth intercostal space midclavicular line to listen to the bicuspid valve. Again, in all areas, I heard S1, S2 heart sounds. There were no extra heart sounds such as S3 and S4, and no clicks or murmurs. I am now going to move on to percussing your chest and your abdomen. So I heard tympani, intercostal space 1 to 4. Starting at 5, I started to hear some dullness where the liver would be. 6, dullness. 7, dullness. And down to 8, which would be the liver. I'm now going to go to the left. Tympani, 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 tympani. Cardiac dullness and splenic dullness is noted starting at intercostal space 5. We are now going to have you turn and show me your back again. There's flatness over the scapula bilaterally. Any tenderness here?
No.
All right. Then all areas there besides the scapula were tympanic and normal with no resonance or dullness. All right, you can face the front for me. All right, so now I'm going to assess your abdomen. As we can see, it is rounded. There is no irregular contour making me think of a hernia. If you can unbutton your pants for me, please, real quick. I'm going to start by auscultating your vowel sounds, starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Vowel sounds are present and normal active in all quadrants. I am now going to percuss the abdomen. We have areas of resonance over the right abdomen, resonance over the left abdomen, and the epigastric bubble. All right, now I'm going to lightly palpate your abdomen. Please let me know if any of this hurts. Any pain?
No.
Now going to deeply palpate and look for masses. All right, no masses were noted. All right, so now we're going to move on to musculoskeletal. You can stand up for me, please. You can see he is very tall. His posture is even. You can relax those arms down for me and take a few steps forward for me. We do see some slight gait disturbance, and turn back around. He appears to kind of drag that right foot. But gait is otherwise steady, does not appear to be at risk of falling. All right, while you're standing, can you please touch your left ear to your left shoulder? Left ear. All right, and right ear to right shoulder. All right, head all the way forward, all the way back. Turn your head all the way right and all the way left. So he appears to have full range of motion on his cervical spine. Can you take your shoulders, arms all the way up, all the way back, all the way in, all the way out? Patient appears to have full range of motion on his shoulders. All right, you can go ahead and sit for me. And can you take your wrist all the way up, all the way down, all the way in, all the way out? And then your ankles, can you do your ankle all the way up, all the way down, all the way in, all the way out? Patient appears to have full range of motion on his ankles as well. I am now going to feel all of his pulses and his lymph nodes. I'm going to start at the occipital lymph nodes, move to the post-auricular, pre-auricular, tonsillar, submandibular, submental, going to do posterior cervical, anterior cervical, supraclavicular, going to do the axillary, and axillary, and the epitrochlear. Any tenderness with that?
No.
There are no lymph nodes able to be identified. No swollen, no redness or tenderness. We are then going to move on to now your pulses. Going to go temporal, +2 equal bilaterally. Going to do brachial, +2 equal bilaterally. Radial, +2 equal bilaterally. Popliteal, +2 equal bilaterally. Posterior tibial, +2 equal bilaterally. And dorsal pedis, +2 equal bilaterally. All right, now we're going to move on to neurologic system. So, can you do the rapid rhythmic movement of your fingers like this? All right, good job. Take your left hand. I want you to touch your nose and then to my finger, back and forth. All right, good job. Going to do the same with your right hand. All right, good job. We are now going to do, can you feel me touch down here?
Yes.
Does it feel the same going all the way up?
Yes.
All right. And what about your fingers? Let me see. Feel me touching here?
Yes.
All right. Any numbness or tingling in your hands or feet?
Just in my legs because I got a bulging disc.
Okay.
Right leg.
We're now going to do, tell me if you can feel this vibration. You feel it?
Yes.
And top of your foot.
Yes.
All right. Can you feel that?
Yes.
Still able to feel it as I move lower?
Yes.
And here?
Yes.
All right. We are now going to check your deep tendon reflexes. We're going to start with your brachioradialis. Just relax that wrist. Just relax for me. Relax. +1 reaction. Going to go to your bicep. I can see his muscle contract up here. Going to go to your tricep. Just relax that arm. +1 movement. Going to go back over here to his other brachioradialis. Relax. +1 movement. Bicep. +1 movement noted. Going to go to your tricep. +1 movement. We're now going to go to your patellar. I'm going to help you lift this leg up since you're so tall. Just relax. Let that leg swing. +1 movement noted. Let that leg swing. +1 movement noted. Now we're going to go to Achilles. Going to apply gentle pressure. And I can feel resistance on my hand. And again, I can feel his foot press on my hand. We're now going to go to his plantar reflex. And his toes did not fan out, so that's negative as expected, age appropriate. Again, plantar reflex negative, which is age appropriate. All right, now we're going to review his cranial nerves. I did most of these during my examination. We did not assess cranial nerve 1, olfactory nerve, which is sensory, but that is not required for this assignment. We did assess cranial nerve 2, the optic nerve, which is sensory, when he looked at the Rosenbaum chart. We assessed cranial nerve 3, ocular motor, which is a motor nerve. When we did the 6 cardinal directions of eye movement, we assessed cranial nerve 4, the trochlear nerve, which is sensory and motor, which is just motor, whenever we did the 6 cardinal directions of movement. We did the abducens, cranial nerve 6, which is a motor nerve, whenever we did the 6 cardinal directions of movement. We are now going to assess cranial nerve 5, trigeminal, which is sensory and motor. And can you clench your jaw for me? I'm able to feel the patient's masseter muscles contract strong bilaterally. And open your jaw and don't let me close it. And again, muscle strength is strong. Can you feel me lightly touch your face?
Yes.
So I can tell that the sensory part of the nerve is also intact as well as the motor. We'll then go to the facial nerve. Can you make a smiley face for me? Frowny face? Frown? Lower your eyebrows? Raise your eyebrows? Puff out your cheeks? All right, so we can see that his facial nerve is intact. That is cranial nerve 7, facial nerve, which is sensory and motor. We will then do his vestibulocochlear nerve. and which is a sensory nerve, cranial nerve 8. Can you please tell me what I whisper?
I hear the whisper.
Okay.
Just hear the whisper.
Okay. And have you had a history of hearing problems?
Yes.
Okay. So the nerve is intact. He is able to hear me. So we would need to rule out either sensory neuro versus conductive hearing loss. We can then test the glossopharyngeal nerve and the vagal nerve just by him being able to swallow and have a gag reflex. Can you swallow for me? All right. And can you say la la la?
La 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 la.
And ta ta ta.
Ta ta ta.
And that also shows his ability to phonate, which tests cranial nerve 9, glossopharyngeal nerve, which is sensory and motor, and cranial nerve 10, the vagal nerve, which is sensory and motor. We will now test cranial nerve 11, the spinal accessory nerve, which is a motor nerve. Can you try to raise your shoulders for me? All right. And turn your head to the right. Don't let me push it back. And turn your head to the left. Don't let me push it back. You can see cranial nerve 11 is intact. And then finally, we will assess cranial nerve 12, the hypoglossal nerve, which is a motor nerve. Can you stick out your tongue and move it side to side? So you can see that nerve is also intact. I'm now just going to think for a second, make sure I did not miss anything. All right, I believe that concludes our assessment. Do you have anything else for me before we conclude?
I believe you did a great job.
All right, thank you very much. Have a good day.